How do you correct class 2? Do you use rubber bands or headgear, forceps, mini screw, Invisalign, or carry a motion appliance? I guess you use interarch elastics most of the time. And how will teeth move when patients wear class 2 elastics? Is it like this? But will teeth really move like this? No, this may happen in a heaven or in an ideal world. In reality, class 2 is not corrected like that. If I slightly exaggerate, teeth will move like this. Occlusal plane is changed, but how? Patients didn't wear rubber bands on the upper incisors, but why are they extruded? It is because arch wire is holding anteriors and posteriors together. The vector of rubber band is like this. One is distalizing force, and the other one is extruding canines, like that. What can be a problem if upper incisors are extruded? Yes, it is gummy smile. And how can it be prevented? There are lots of things that I like to discuss about class 2 corrections. How are your class 2 patients? Is it easy for you to correct class 2? Or do you have some patients that you cannot reduce the overjet and the class 2 relationship? In what patients we can correct full stack class 2 without extraction, and in what patients we need to extract? How can it diagnose? I will discuss in full depth about class 2 correction in my online course. I look forward to seeing you there.